mynews.studio.
In Cameroon, a child's first steps might now happen after their first malaria vaccine. Could this change the way Africa fights disease?
Today is October 29th, 2025. Let's get into the basics. Earlier this year, in January, Cameroon became the first African country to start routine malaria vaccinations for children. Why is this milestone so important?
Malaria still claims the lives of nearly 5 million children each year in Africa. For a long time, prevention relied mostly on bed nets and anti-malarial pills. This campaign is the first time a government has launched a widespread vaccination effort against malaria. Cameroon is in effect testing whether routine vaccination can shift those numbers.
How effective is this vaccine? What are we learning from Cameroon's rollout so far?
Early signs are positive. By the end of last year, about 65% of eligible children received their first dose. Catch-up campaigns helped too. The percentage of kids getting all 3 initial doses went from 25% in April to 48% by December. The vaccine, called RTSS, isn't perfect, but when used with other prevention methods, it's been shown to cut malaria deaths by up to a third and hospitalizations by 60% in the highest risk areas.
That's a notable reduction. What's driving these uptake numbers? Are most parents on board, or is there some reluctance as well?
Overall, acceptance is high. A nationwide survey showed 91% of parents were supportive. But it's not the same everywhere. Some regions do see more hesitancy, often because of misinformation or mistrust. To address this, Cameroon shifted away from broad media campaigns and instead focused on connecting through local communities. Health workers and local leaders meet parents face-to-face, answer their questions, and address concerns directly.
So it's more about trusted messengers, not just radio ads or posters. Did that make a difference in those hesitant areas?
Yes, it helped. Having people that parents already know and trust deliver the message made a visible difference. The Ministry of Health also got parents involved through schools and religious groups, so the message reached families in places they already gathered.
Let's talk logistics for a moment. Rolling out a 4-dose vaccine sounds challenging, especially in rural parts of the country. What hurdles have they faced?
Supply is a major challenge. There aren't unlimited doses, and keeping the vaccine cold as it travels to remote areas can be difficult. Data tracking is another issue. It's sometimes hard to know exactly which child has received which dose and when. Plus, the schedule stretches over several months, so families need to stay engaged. Still, many parents are already reporting fewer malaria cases and hospital visits among their children.
Other countries are watching this closely. What can they learn from Cameroon's experience so far?
A few things stand out. First, community involvement is essential. Top-down campaigns alone aren't enough to overcome hesitancy. Second, logistics matter. You need a reliable supply chain and solid data systems. Third, integrating malaria vaccination with existing health services helps. When parents already bring children for other vaccines, adding malaria makes it easier.
Looking to the future, what could happen if more countries adopt this approach?
If this model is scaled up across Africa, routine malaria vaccination could protect millions of children each year and speed up progress toward eliminating the disease. Early data from Cameroon and pilot programs in Ghana, Kenya, and Malawi show that combining the vaccine with bed nets and drugs can sharply reduce deaths and serious illness. It's not a complete solution, but it is a significant step forward.
And outside Africa, why should people elsewhere pay attention to what's happening in Cameroon?
Malaria remains one of the world's deadliest diseases, and progress in one country can offer lessons for public health everywhere. Cameroon's approach shows how to integrate new vaccines, build trust, and strengthen health systems. It's also a reminder that science, policy, and community action all play a role in making real gains.
So just to recap, Cameroon's malaria vaccination campaign marks a major public health moment, with early results looking promising. Their strategies for outreach, logistics, and building trust offer lessons not just for Africa, but for the world.
And as more countries follow suit, the chance to reduce malaria deaths and hospitalizations becomes more real. Thanks for joining us as we looked at how one country's effort could change health outcomes for millions.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.